Hello, my dear viewers. Welcome back to my channel, Sri Lanka Health Podcast. Just to introduce myself again, I'm Prabhat, one of the doctors currently based in the UK. I'm working in National Health System, NHS system at the moment, and I have plans of going back to Sri Lanka because I'm a migrant from Sri Lanka working here, and in next couple of months time I'll start work in Sri Lanka, and which I would love to work there. And I've had my 90% of my career already finished in Sri Lanka, and I've only been working here only for 1 year and 1 month in the UK. Actually, it's for overseas training of myself. Right, coming back to the topic, it's about chest pain again, this health podcast. And I'll remind you what I have done with you the discussion previously. It's about sinister causes of chest pain. If you have not seen it, please go back and read it view it first, and then coming back to this video will be more informative. I'll quickly remind what I've discussed. I've discussed the sinister causes of chest pain. One is coronary artery disease, that is clogging of a blood vessel which supplies blood to the heart muscle, which is called a heart attack. Number two is pulmonary embolism, that is clogging of blood vessels which supply blood to the lung parenchyma. Number three, it is pneumothorax, that is trapping of air in between the lung parenchyma and the chest wall. Most of the time in acute medical setup, it is spontaneous rather than traumatic, because traumatic patients most of the time they go directly to the accident and emergency. Usually you may wonder why would a person would have a spontaneous pneumothorax, or where a spontaneous collection of air in between the chest wall and the lung parenchyma. Most of the time it occurs in tall, thin, young people, and especially the smoking can be a predisposing factor. And last but not least, which is one of the most dangerous causes which should be treated immediately, is dissection of the aorta. Aorta is the main blood vessel which supplies blood and which transports nutrient oxygen through blood from the left side of the heart to the all major organs and all the peripheral tissues. And in the heart, when it at the site where it connects to the heart, it can dissect, it can leak, and it can cause some damage to the blood vessel, which can cause a steering of the aorta and which can cause severe chest pain, which should be treated immediately. Otherwise it can be life-threatening and it more high mortality. That means high risk of death if you're having all of these four causes. But the today's discussion is not about those causes. Actually, I would like to address the majority of chest pains, why people come to the acute medical setup, and what are the causes of those presentations. Well, most of the time, the chest pains, the patients coming with chest pains, they don't have any sinister cause, because there are a lot of other causes which are just self-limiting and which is not due to any sinister cause, which can be settled on its own. But what are the features which we can differentiate the sinister causes, or just a chest pain, or just a musculoskeletal chest pain, or just reflux associated chest pain, just gastritis associated chest pain? How can you differentiate? Well, I would answer that question, but with one condition. I would advise for any of you, the cause for chest pain should be assessed by a trained healthcare person, because you cannot decide by yourself whether your chest pain is sinister or it's just a chest pain, musculoskeletal chest pain. That means self-treating or knowing few facts. Depending on that, if you try to decide what kind of chest pain you are having, I think that's not the way forward. That means if you have any chest pain, you should seek healthcare advice. It depends on the country you live. In the NHS, you have to call 999, or you can call your GP depending on the emergency, depending on the circumstance, or you can come to A&E. Then discussing with your friend and searching in internet, those are wise things which can be done for some other complaints, but not for chest pain, because immediate action, immediate diagnosis is vital, because immediate treatment is important. Therefore, try not to diagnose yourself with any chest pain. You try not to decide that why I am having chest pain. Just let it to a medical person to decide, because they are well trained, and they most of the time in developed system in whatever the country, because there are some currently there in most of the countries there are healthcare people, that healthcare persons who can attend immediately and who can assess your symptoms, or you can go to a hospital. I think that's the most wise thing. So take home message is never try to diagnose yourself by yourself, and always ask from a medical person immediately, and access to your emergency health assistance line in NHS 999, and depending on the country, whatever it is, then immediately seek medical advice. Try not to diagnose. But in the next video, we'll discuss about what are those causes, other causes of chest pain,